Back, the Denis Hurley Centre has assured undocumented immigrants that they won't share their details with authorities if they choose to get vaccinated for COVID-19. The DHC in Durban has been chosen as one of the few organisations, the Department of Health, to pilot their programme of vaccinating undocumented immigrants. And to speak a little bit more about this, we speak to Raymond Perrier. He's the director of the Denis Hurley Centre. Very good evening to you, and thank you so much for speaking to us, Raymond. So, what were the terms of the pilot programme of vaccinating undocumented immigrants? So, did you consult with government, or were they pretty much handed down to you?
No, it's been a process of consultation and collaboration, and that's really why this approach is working. We have a huge number of people in this country who are undocumented. Some of them are foreign nationals, some are South Africans who don't have IDs, particularly homeless people. But for the vaccination program to be effective, we need everyone to be vaccinated. COVID doesn't distinguish between people with or without documents, so the vaccine shouldn't either. So I'm really delighted that from the beginning, Dr. Nicholas Crisp, the Acting Director General of the Department of Health, has really shared our passion for making sure that everyone has access to the vaccine, and they've been working with us and other NGOs and with the Department of Health to come up with a system that works, that protects individuals, but also makes sure that they can be vaccinated.
So, as you say, the pandemic, it doesn't differentiate, and I'd like to know from your personal experiences now and perhaps previously, what the challenges of working with these two groups of people have been: foreign nationals and homeless people. These are vulnerable entities.
Absolutely. They're very vulnerable people. They're often living in very poor conditions. And so all the things we've talked about in terms of social distancing and frequent hand washing and so on becomes much harder if your life is not as straightforward, is a bit more chaotic than other people's lives. We worked hard here in Durban with eThekwini municipality to make sure that homeless people were protected during the hard lockdown last year. And now we're working hard to make sure that people are getting access to the vaccine. One thing that we need to bear in mind is that these are both groups of people who, for good reason, have a history of being suspicious, should we say anxious, about any kind of interaction with government. And so it would be very hard for a government official, no matter how well-meaning, to turn up with a group of homeless people or a group of refugees and say, we're here to help you, because people have a history of not being helped by government. And that's why it's really important and really impressive that the Department of Health has recognized the importance of working with organizations like the Denis Hurley Centre, other members of the National Homeless Network, other members of the Refugee Network community, to make sure that they've got partners on the ground who know, who understand, and are trusted by these vulnerable communities.
And I want to talk about that issue of trust. Is there not a natural suspicion of the work that you're doing, given the close connection you would have with the state in the rollout of this program?
I think not. You see, we've been providing primary health care here on the streets of Durban to refugees and homeless people for 7 years. They know us, they know our nurses, they know the people who come here, they know the social workers, they know that we are people that they can trust, because we've proven that to them over and over again. And I think because they're seeing us working alongside the Department of Health, they recognize that we wouldn't endorse something if it wasn't acceptable. But part of what makes this also effective is that the vaccination process is happening outside. It's not being hidden away anywhere. And the vaccines are equally available to anyone who's walking past here. We're right in the heart of the markets in the centre of Durban, so anyone else can come in and get a vaccine at the same time. So this isn't a special program, this isn't a special vaccine, it's the same that everyone is getting, and I think that's a great reassurance to people as well.
And the reason I ask this is obviously you have to provide the details of whom, what, where to the government for the purposes of the vaccination program. So you say you've developed some trust. Has that resulted in a greater turnout because people know that you will use their details responsibly, or at least to help keep them safe as well?
Exactly, yes. We've seen that straight away when we started, particularly with the homeless community. When we first were vaccinating homeless people, they had to have documents. And about half of all homeless people don't have an ID. So we had people wanting the vaccine and they couldn't access it. As soon as we said you can get the vaccine without having an ID. We had a good number of people. I think we were running at about 60 or 70 a day last week. And now foreign nationals are equally coming along and wanting to be vaccinated. All they have to do is give a name and a date of birth. They don't have to provide any documents. They don't have to prove their name even. And the only reason the name and the date of birth is given is so that can be used to generate a unique identifying number for each person so that the Department of Health can track the vaccines. Remember, they're not trying to track the people, they're trying to track the vaccines.
Well, thank you so much for speaking to us, Raymond Perrier, Director to the Denis Hurley Centre. Well,